Well, why don't we start off just with what is dementia
Sure,
and go from
sure.
there?
Right. So I'll share a small presentation. I'll just send you a request to let me share the presentation.
Okay.
Um, but just a second. So dementia, as you know, we probably all of us here who are here may have some understanding. It's really a neurodegenerative disorder, causing us confusion, changes in mood, memory loss, poor judgment, finding it difficult to complete familiar tasks, and many, many more areas, right? So, in a very simple way, it's a neurodegenerative disorder. It's when your neurons stop talking to each other. There is blockage in the transmission of the communication, so as to say, and uh, that reduces the person's ability to understand, to learn new things, comprehend, make judgment about certain things, confusions, lack of orientation to space, time, um, overall difficulty in managing tasks. So, is there anything I would have missed? Please do let me know. But broadly, these are the areas. We associate dementia primarily with memory loss and the fact that you're forgetting things. But there are many other sorts of challenges which can come. There could be language difficulties. There could be loss of words. There could be uh, you know starting with confusions, behavioral challenges, so there are different types of dementia. Dementia is really an umbrella term. It's like, you would say it's like fever, right? And it's used to describe a range of symptoms, and there are multiple types of dementias. Some of them are documented, well documented, but then these are not the only ones. There are multiple others. Alzheimer is the most common form of dementia, impacting mostly people in their old age, and most prominent and common type of dementia. Then there's vascular dementia, which is really related to comorbidities like high blood pressure and stroke and those kind of issues. Then there is Lewy body dementia, there's Parkinson's induced dementia, then there is frontotemporal dementia, uh, which is more challenging, and it's about behavioral challenges, which is one of, and we have seen that it is one of the dementias with also um, traditionally sets in early at an early stage, like in their 50s or early 60s. We have even actually seen patients with dementia in their 40s. And then there are dementias due to alcohol abuse, and there's mixed dementia, and then there is other sorts of dementia which are drug induced. There's autoimmune dementia, and we are learning on the go. There's more and more about this illness, and but the underlying thing is that the symptoms are pretty much the same, overlapping in some areas. Sometimes it is more on the memory, sometimes it's more on the language comprehension, and so our endeavor and what we propagate to the families and the caregivers is really to see how you're going to manage the behavior which is now impacting your loved one, and how are you going to take care of them. So uh, so with that, Sonia, I can move to the
Yeah,
um,
do you want to next maybe differentiate between dementia and Alzheimer's?
right. So I can also uh, just take a minute to, this is a very popular table, and it's used very widely to explain what is normal aging and what is, dementia. So forgetting names of people we don't see on a regular basis. Yes, we meet a friend after many, many years, or we meet an acquaintance after many years, and it's hard to recall the name. But when you start forgetting names of people who are very close to you, uh, then it's a challenge. Uh, we all use Google Maps now and we remember directions, but when you start getting lost in familiar places, or you suddenly realize that you're not finding the way home, then that's a concern. Uh, Being disorganized and gradually becoming indifferent about it, loss of interest, loss of social interest. These are, over a prolonged period of time, these are also signs of, cognitive decline. We all have moments or days when we don't want to be, the best of ourselves, and, we don't want to talk to people, we don't want to socialize. But then, there's a normal limit and we come around it. We have mood swings, we may have, stressors in life, and we may have all sorts of things. But then when your mood changes become unpredictable, you start getting anxious, you start getting upset about small things. That's where these are the very early signs, which are very hard to even determine, to relate it that there is something happening to my parent, and I need to do something about it. Then there is this just decreased interest in activities which you were liking earlier, right? You may have change in interest as a normal part of aging, but when you start losing interest in things which you like to do a lot, for example, if you like to watch movies, or if you like music, or you like playing cards, but now you don't no longer feel you want to socialize with people, you want to be just, you're becoming more and more quieter, then these are signs to watch out for. Loss of words, occasionally we all search for words. I do, it happens to me a lot. Multitasking, always on the run, trying to do 6 different things at a time. I keep telling my colleagues that, I don't know what's happening. But uh, yeah, if you start having difficulty in finding words, so for example, I'll give you an example. I can see some very initial signs with my mother. So she's forgetting the name of my niece or my son. And so it happens once in a while, but it's not something very, normal. And you can see that that is causing, that's a sign of concern which needs to be, addressed. So what was your other question, Sonia? You were asking difference between
Well, yeah,
Alzheimer's?
because a lot of us will use the words interchangeably, but are there differences, and what are there? What are they with Alzheimer's and dementia?
Right. So like I explained, dementia is an umbrella term, right? So it's really, Alzheimer is a type of dementia. We use it more commonly because it is one of the most prevalent types of dementia, right? But essentially, dementia is like fever, and then and Alzheimer's is like dengue, or some other kind of fever, right? Malaria, or whatever you want to call it. So it's just used very loosely. There is Alzheimer's Disease International, but then dementia is an overarching term, and it's Alzheimer is one type of dementia. Yeah,
All right, thank you.
yeah.
So
So
I'm sorry, go on. You were saying that there are signs, and what are some other signs that people can look out for?
right. So before that, I just want to very quickly, show this slide, which is about the risk factors of dementia, and what are there are multiple risk factors associated. There's a number to each of the risk factors, and some of them are because of, in the early life, that is, education plays a part of it. And these are percentages which contribute, which are risk factors contributing to your probability of dementia. But then there are certain risk factors which are modifiable. So for example, let's look at the late life issues. So social isolation, right? Visual loss, air pollution, obesity, excessive alcohol intake, smoking, diabetes, lack of physical activity, hearing loss. So these are all, some of these are modifiable risk factors. So for example, physical activity, obesity, alcohol intake, smoking, these are all things which are in our control, right? The need for socialization. Depression can have, old age depression can be a reason, can manifest into dementia, and or the other way around. There is, this topic is widely discussed, but that's why, mental health in older adults is equally important, even if it is not necessarily dementia, but it needs to be treated in time, and it needs to be addressed with, whether it's cognitive behavior therapy, or with medication, or with socialization, or different purposeful engagement, etc. So just want to leave you with this thought. This is a Lancet study report, and air pollution, by the way, is something they added very recently in 2024 to this list, which was not there earlier. How can you, so I've already spoken about the risk factors for dementia, and how can you, controlling your blood pressure, sugar, obesity, etc. Uh, so what are the early signs, like you were asking? So difficulty recalling recent events or conversations, right? So there is I'll just share a small story of a doctor, which, he shares with us all the time. This was a doctor in a government hospital. And he said, this patient came to me and she says, my I'm very fed up of my mother-in-law, because she's she keeps accusing me of not giving her food. She accuses me of not giving her lunch, and and I'm upset and depressed about it. So when the doctor, he was a psychiatrist, so he questioned more, and then he says, no, I serve her food, and after every 10 minutes or after half an hour, she'll say, you didn't give me food. So then he realized that the problem was not with the lady who was there, but it was really with the mother-in-law. And she was having difficulty recalling that she had her meal. She was having a repetitive behavior symptom, and so that's how they discovered that there was a patient in their house who had dementia. And this is in a setting where probably awareness levels about dementia are very, very less, right? So so that's the challenge. If people do not understand the symptoms and what to look out for, then it can be confused with a mental illness. It can be confused with all sorts of things, and especially and we have heard the most bizarre of stories from people, oh, that they have been possessed. And like in India, there are a lot of traditional uh, things sometimes people think, and the way you look at the illness, the understanding of the illness is very little now, at least. And I'm talking from my working in this area for the last 12 years now. Now, of course, there are a lot of media, and there are some movies out there, which are helping in some sort of way to create awareness about, what this illness is. Repetitive questioning. These are the very initial signs. Keep talking about the same thing repetitively, and not realizing that you are being repetitive. Challenges in finding the right word, of putting stuff in the wrong place. You don't know where the sink is. You're putting your shoes in the refrigerator. Or you're putting your keys in the fridge. So those kind of issues are a challenge. Shift in behavior and mood, and disorientation with time, date, or location. That happens a lot. People do not realize what time of the day it is, where they are, and that's why one of the things which is very important is to keep reorienting people to place, time, and location. So these are some of the early signs of dementia, as we say. And any questions, you please feel free to type it in the chat window. And Sonia, you want to?
Yeah, that just brings up a question we didn't really talk about, but are there tests for dementia?
Yeah, so there is actually, see, diagnosing dementia is actually a multidisciplinary team is needed, because there are different ways of diagnosing dementia. Of course, there are MRIs and CT scans, which is one part, but then there are questionnaire-based assessments, which organizations like Samvedna can help with. And then we, of course, have our own self-assessment tool. And I'll just ask if my colleague is there to share that link in this chat window. But that's a screening tool. So diagnosing dementia is like I said, it's done at multiple levels. There are blood tests. The doctor will probably ask for a blood test, and then there will be a scan along with a detailed psychological assessment. And there are certain question-based questions which are rolled out to the elderly. And then there are other ways of other tools to help in where the patient is not being able to answer the questions which are meant for him. So then there are other ways of getting information from the primary caregivers. But these are typically the ways in which dementia is diagnosed. Dementia can be diagnosed by a family physician, by a psychiatrist, by a neuropsychologist, by a neurologist. So there are multiple, by a geriatrician, of course. Uh, your family physician should ideally be the first person to go to. And of course, you can also go in for a psychological evaluation and a psychological, self testing as well. So I think this link here is yeah. So this link here, you can just see this, click on this link at later time and take a self-assessment for yourself or for somebody in your family. This is a screening test, so this is not like a formal diagnosis, but this is pointing you in a direction. And then this is followed up with a formal psychological assessment, which organizations like Samvedna do. And then, of course, there is a report which can be then which a psychiatrist will corroborate with the brain screening, etc., to see that these are all fitting in. There could be
That's the
chemical.
link in the chat. I'm
Yes.
sorry, the link in the chat that
Right.
Navia
Yeah.
put. Yeah.
Yeah. There is chemically induced dementia as well. So low sodium could also throw up symptoms similar to dementia. And that's something really, really important to watch out for. Because as people get older, they start saying, I'm not hungry, I don't want to eat much, and they start compromising on the nutritional value of the food. right? And so that can actually lead to a drop in sodium levels. My father actually he went through that phase, and then it was, of course, then it progressed into Parkinson's and other things, but uh, it was completely avoidable because it's so monitoring their diet and ensuring nutrition in the meals is very important, so, and elderly, when they're living alone, they tend to be more careless about how they're living their lives, and how they're eating, and spending time.
Let's say we are caring for someone with dementia at home. What are your some suggestions on how to care for them? You mentioned diet. It's very important.
Right. So I think the most foremost thing to do is for and I was also just watching the rollout of the World Alzheimer's Day report yesterday, 2025, because on 21st is World Alzheimer's Day. And this cannot be overemphasized enough, but the need for a proper diagnosis is very, very important. Okay. And sometimes diagnosis itself can take more than a year, 2 years. We have seen patients who are just going from one doctor to another, to another, to another, not willing to, because to stick with a doctor, try do the medication, and then if you don't see the results in a prolonged period of time, then you go in for a second evaluation or a third evaluation. But since doctors are accessible, I must say that in India are more accessible than the US. So people people are looking for quick results, and that's again the fallacy of the illness, because it's not something which is going to get changed very quickly, right? You have to give it time. Even the medication is going to take time. So understanding, getting the right diagnosis is very, very important. And that's where organizations like us come into picture, because we help and guide people what to do. Then once there's a formal diagnosis and you understand at what stage, or what is the progression of the illness, then you can devise a care plan for your loved one, right? So now that care plan can be made um, in collaboration with the professional, and that's probably the best way to do it, with a physician, with a psychologist, or with a neuropsychologist. And there are different aspects to this. So there is and this year, by the way, what we have been doing for so many years at Samvedna, I saw that the emphasis in this year's World Alzheimer's report was on the need for cognitive rehabilitation, which was very interesting. And there are, of course, three things to that. One is setting a routine. Setting a routine for the person with dementia is very, very important. Uh, whether it's their waking hours, their toileting habits, their bathing, their meals, their time to socialize, to go in the park, their time to take an afternoon nap, their time for activities, or their sleep time. The need for routine cannot be overemphasized, because that's the first and foremost thing we tell all our clients, that you need to have a routine. And that's the uh, you know there's a challenge in that, because sometimes what happens is people are on medication, and then they say, oh no, they're sleeping in the day, and then they're awake the whole night. They are going to be awake. They're going to be awake the whole night if they're not meaningfully engaged during the daytime, right? If they're not physically exerted, they're not involved in activities, whether it's a walk or it's some sort of stimulation, right? So that is very important, the need to set routine. uh, Diet, meal planning, right? So what is it that you are what are the kind of what is the nutritional value you're giving in the meal? What is the kind of diet you're providing. Sometimes I've heard people say, they don't sleep, so, he likes to have his drink. So a drink and dementia just don't go together, right? But uh, alcohol is a strict no-no. But there are families who say, no, this is the way he's used to it. He was in the army, so he likes to have his drink. So it's very hard to explain that, this is not, you need to move away from that. It's not going to help, right? The need for, in terms of sleeping, right? So, and before sleeping, overstimulation. So there are families who have told me, oh, in the afternoon from 2 to 5, I just put on Veer Zara for, I don't know if everybody here understands, but it's a very famous Hindi movie. My wife likes to watch Veer Zara, so I put it on and she watches it on repeat every day. I was shocked, because that is so much overstimulation. And you may think that you're engaging your elderly, but that is not the right way to engage, right? That is just keeping them occupied. It's like, you make a child sit in front of cartoons and then, they are so happy watching cartoons, right? So it's just overstimulating the brain. So, these are the things which we like to educate people about, and this is where this whole aspect of cognitive stimulation, cognitive rehabilitation comes into place, because what we saw in the first slide, issues about memory, about judgment, reasoning, spatial orientation, all these aspects can be worked upon, right? And uh, there are exercises, there are interventions which can be, which can be planned and then which are done with with a therapist, and these can really help the elderly, exercise those parts of the brain which are now becoming dull, so as to say, or which are so that they can they can stimulate the brain cells, right? So when I say this in terms of these cognitive activities, I also want to say that uh, every person in dementia is unique. Okay, that's why the need for diagnosis, a proper diagnosis, the need for routine, the need for understanding the complete history of the patient, of the elderly, the background, their interests, their education level, their capabilities as of date is very, very important. And that's why these assessments come in handy, these cognitive assessments. And then designing a care plan helps, because the care plan has to be person-centric, it has to be individualized, right? So there are multiple settings, in which we can provide dementia intervention, right? So there are day centers, right? There are group therapies. But the individual person-centric approach is the best. It is probably also the most costliest and also the hardest to reach as many people as possible, right? Because there are only so many people. But you need to work with your elderly based on these aspects to design the care plan, and get professionals to help you with the care plan, and maybe you learn from the professional or from somebody like us as to how to execute that care plan, right? So we have like programs like this. So Samvedna has a caregiver enablement program, for example, right, which helps the family understand the illness, and then we do, and especially in the COVID time, this was very useful because we could not go into homes of people, right? So we were supporting families remotely. We were telling them, we were giving them certain activities, and then if they had challenges, we would tell them to record the video, share it with us, and then do it the right way and the wrong way. So there are multiple ways of educating the family, right? But so the person-centric approach is the best approach, right? The other aspects of caring for somebody with dementia is, I mean to say, the need for socialization itself, right, is very, very important. So, um, and when you're caring for somebody remotely, it can be a challenge, right? But whatever time we can give to our parent, whether it's a phone call or it's some way of it's a video call, it helps. Socialization, companionship, we have seen it. We have multiple clients. We have actually worked with clients of all stages, right? We have worked with clients who have advanced stage dementia, who have lost capability to speak, who have, who are bedridden, who have challenges in vision, hearing, etc. And there is a way for us. The goal is always to see how we can uh, engage with them emotionally and socially, so that at the end of the day they feel good about themselves. There is a certain quality of life which we can give them. We can give them some dignity, and there is a the self-esteem maintains, is kept, is restored, right? Because uh, it's very hard when you are the caregiver to do a lot of these things. I'm speaking from personal experience, because we all like to see our parents in a certain way. And when we see them behaving in a different way, it is very difficult for us to accept. But that's where then you should be seeking help. But knowing that there's a person behind that illness, and that person has insight, is very, very important, because uh, that that will help you maintain that connection with the person, and be able to uh, provide provide the intervention, the stimulation, and the engagement, which is very, very much needed, right? um, Roping in a professional carer, if it is an advanced stage care, is very important, right? So, for example, a lot of times people say, my XYZ is living alone and they have dementia, but she's fine, and I don't need anybody. I just need somebody to come in for 4 hours or 5 hours. That's, I mean to say, I can understand where they're coming from, because that is one view of looking at the patient. But a person with dementia who is in advanced stage, who is having issues with cognition, and who is having confusions, doesn't know, how to lock doors, how to switch off the gas, how to light a fire in the, kitchen. These are all risks, right? And you want somebody to be there just to keep an eye on them. It's not necessarily that they're caring for them physically. So at that stage, you need to have somebody who is going to be there to ensure that there's not going to be any self-harm, unintentional self-harm, which the person can do. Uh, Yes, at a later stage, you will require a carer to help you, and if you can afford it, of course, you will need a carer to help you with advanced care, activities of daily living. There is bathing challenges, there is self-hygiene challenges, right? There could be difficulty in wearing clothes. There could be mealtime supervision, which is needed because the person is not able to eat well, right? They may eat either too much or they may not eat. There could be challenges with swallowing, and there could be other physical changes which may happen. So at that stage, you do need somebody who can be there with your parent as a caregiver around the clock. And fortunately, in India, these are still affordable, right? And of course, it is still hard to find a good caregiver, but it is something which is probably not so costly as probably in in the Western context, I may say so. And so you know, but the objective of care should be that how do you prolong that stage, and that's where uh, these um these cognitive stimulation, this cognitive rehabilitation, these initial things which I spoke about, the aspect of routine, socialization, engagement, become very, very important, because we have seen in our journey, when people have come to us at an earlier stage, we have been able to, through the interventions, we have been able to maintain status quo or see very little decline for many years. Maybe, I would say 3 plus 4 years also. There are patients, elderly, who actually had no decline, and only unfortunate thing they had in the very late stage, like I'm talking about 85 plus, they had cancer, late age cancer. So, uh, so the goal should be to see how, we are going to reduce the disability, how we are going to reduce uh, the timeline for long-term care, the timeline for residential care, right? So I'm sure that many of us who are on this platform probably have parents back home, and at some point of time, you may have to make a decision about putting them in a care home, and that could be there. But before that, um, how do you how do you support them in their pre years is very, very important. And what is the best, what are the tools, what are the resources available, we're happy to help, and and then provide the interventions. uh, I also want to share with you that we follow a person-centric approach for dementia care as far as possible. uh, of course, the physical limitation of reaching everyone and everybody is there. And we have been working on a model where we are providing some of the cognitive stimulation therapies online. And there's a video which I don't know if Navya, you can share it in the group and people can see it later. There's a testimonial by somebody who is based out of New Jersey. There are a lot of other testimonials we have for where we are working with elderly for mental health counseling as well. Within India, we have clients in different states, in different cities, where we are able to do cognitive stimulation therapy with them online. Now, some people say online is not going to work. My mother needs the physical touch and this and that. It depends on what stage you're coming in. It depends on if you are at a stage where you are already fidgety, agitated, you have a lot of issues, you have hearing issues, then it may not be the best medium. But if you're at a stage where you're pretty much preserved and you're there, then it can really help in with the cognitive exercises. The other challenge I would just like to share is that you know unlike the Western world, and unlike in India, nobody goes into a clinic and says, doctor, I want to get a diagnosis for dementia, right? I think I'm having cognitive challenges. We, I mean to say, it's far and few. Whereas in the US or UK, people are more because they're living alone, right? And they're open to seeking help. They're open to seeking intervention, and they are open to practicing some of these rehabilitation or stimulation therapies. And that's where the challenge lies for us as a community, and as culturally also. So of course the challenges are very similar. It's just the degree, the levels are different. If you talk to a caregiver who is an American, I'm sure they have the same challenges as we have with any Asian or South Asian caregiver. But I think their starting point is slightly different than ours, and that's where the the whole issue of providing, you may want to give the best care to your parents, but then there might be maybe a resistance, and there may be a pushback, and then there is the importance of educating the immediate circle, right? So the neighbor, the nearby grocer, about the illness is very important, because then you have, at least you create a support system around you, even if you are not nearby, that they understand that this person needs to be may need help, may need some oversight. So I think I'm just going on and on because there's so much to talk, but
Archana, we have a few minutes left, so I just want to remind everyone that we do have another session on Friday, October 3rd, talking about managing finances. But I've also asked Navya if she can put in the chat what's the best way to get in touch with Samvedna, so in case someone needs your services. And so I'm going to stop the recording and we're going to go into the Q&A, because we have a couple of questions in the chat and I'm sure other people have questions too. So thank you very much for this. It was very, very enlightening. Appreciate it.
sure. Yeah, and this is a very vast topic.